Right, so we're going to do a two-part show here. I'm going to talk a little bit about collaboration and what it is, and then Viv's going to talk about the important stuff, which is what we actually do at the Menzies. And in fact, what I'm going to do is I'm going to get rid of them. Just bear with me. I'm going to do what Professor Palmer did, and I'm going to come and stand over here so I can actually see what it is I'm talking about. Okay, everybody still hear me down the back? Yep. So, consumer collaboration, and it's really trying to find a definition of that is important because it sets the parameters of the partnership. And so the Australian Commission on Safety and Quality in 2016 did establish a definition, which I'm not sure that it's the best one that we can ever come up with, but it's the one that we're going to use today and probably into the future. Why is it important? Because again, key government policies and decisions are based around their own definitions, and so the Safety Commission is of course an arm of the federal government, and so this is the one that they use for funding, for example in the NDIS. So consumer collaboration is defined with consumers, partnering with consumers, recognises the value of the consumer voice and the need for consumer experience and expertise to help shape decisions about the healthcare at the level of the system, the service and the individual. So it used to be that there was a great call for consumer participation in your own care. So if you were in hospital or you're in the community, the call was make it a partnership. But then it went, and we realised that in fact at the service level we should also start to be talking about. So for example, within the Department of Health here in Tasmania, we used to run consumer participation studies because we realised that we needed the feedback to tell us what the services that were required. And then finally, at the sort of the high end, which is the system level, it's about what is it at the system level that we need. And a lot of the research that's been presented today influences those systems and how consumers collaborate with researchers, policymakers, funders, etc. It goes to show, very simply, that if we're the recipients, as in the people with MS are the recipients of care, then we can provide feedback about that care. And whether it was good, bad, whether it worked, whether it didn't work, whether it was pleasant, whether it was unpleasant, etc. And we are critical to that feedback loop. So we provide that feedback to the researchers, to the healthcare providers, etc. They take that information, they percolate it, and they then adjust their healthcare system or their research to accommodate the feedback that we've got. So it's a simple feedback loop. They then provide us better care, we then provide better feedback, and so on and so on. The collaborative guidelines, there are two key sets of guidelines. There's legislative guidelines and social conscious. Now, you'll be able to find the legislative frameworks, because there's lots of them, but you will not find the social conscious ones because I just made that up for this slide. But for the consumer collaboration, the legislative frameworks, there are lots of them. And in fact, many people don't realise that the United Nations Conventions on the Rights of Persons with Disabilities, of which Australia is a signatory, actually requires all health service providers to have consumer participation. It actually goes further than that. It says that if you are a consumer, you can ask and rightly receive to be able to participate not only in your care, but at that service, system and individual level. So the United Nations, again, to which we are a signatory to, is a powerful tool. And people see it there and they don't really think, well, that's not important because I live in Tasmania or I live in Hobart or I live in Broken Hill or wherever. But actually, when you start to think about you're not receiving the right service or, for example, you can't get access to the NDIS, guess what frameworks we use to lobby? We use these frameworks, and so those conventions are really important. Other conventions, the World Health Organisation also recognises the importance of consumer collaboration. Coming back to Australia, the Australian Government, the Department of Social Security, they've got a key definition around consumer collaboration. I know that our distinguished Professor Alison Venn is very clear around the National Health and Medical Research Council and the need for consumer collaboration to have for consumer collaboration to be part of their deliberations, and of course research funding advocacy institutions like the Menzies, like MS Research Australia, were acutely aware that we need to have consumer collaboration to inform us to make good decisions. So, National Health and Medical Research Council, and I just put this slide up because it's really interesting to watch over the years how important consumer collaboration has come. And I have to pay tribute to the mental health specialty area, if you like, because it was actually the mental health consumers in the sort of 1970s when institutions were being deinstitutionalised, that consumers and carers become very loud and demanded better collaboration. So if you look at the National Health and Medical Research Council, in 2002 they said consumer collaboration, it might be a good thing. Let us think about it. In 2007, it said, we think it might be a good thing, but let's ask the researchers. So they said to the researchers, what do you think? Then in 2016, they jumped and they said, not only do we think it's a good thing, we now require the researchers to demonstrate extensive involvement. Still not quite the mandatory requirement, but in 2016 it said demonstrate extensive involvement. And then in 2018 the Australian Code for the Responsible Conduct of Research came out and said adherence to the 2018 code is a prerequisite for the receipt of funding by the National Health and Medical Research Council. So bang, you have every right to be involved in consumer participation at both individual, service and system levels. So, didn't take long, but 22 years is not a bad time frame for health bureaucrats or government bureaucrats. The benefits of consumer collaboration, look, there are lots of them. For the researcher, it's about consumers providing that lived experience, walking in our shoes, and it's our tagline, nothing about us without us. And so the researchers have very little understanding, unless of course they've got MS themselves, of what our lived experience is. So we're able to provide that. But consumers are also not one-dimensional. So, for example, I'm a person with MS, but I'm also a carpenter, I was also a nurse, I've done a bit of research, I've been a father, I've been a brother, etc., etc. So we're not one-dimensional. So we bring a lot to the table, plus our MS. Institutionally, it's really important for institutions, in fact, for the consumer collaboration to be seen. Because part of the, the reputation of institutions lies in its engagement with the community. And 26,000 people across Australia have MS, and we are a large community. And so the institutions like Menzies, like again MSA, must have good consumer collaboration in order to give credibility to the work that it does. Otherwise, it's, with all due respect, something happening in a petri dish in a back room somewhere. So it's really important that the institutions provide the collaborative access. And then finally, for us, the consumer and the community, we get a reassurance that the research that is being undertaken is actually research that is relevant to us. We also gain a lot of information back, and so it's informing us, it's keeping us interested, and it allows us to, improve not only our self-interest but our self-image, and ultimately, once you get involved, you can it's hard to shake. You want to go more and further and deeper. And so if you're not involved already, please get involved. And I guess the other thing is I've put up there, you do get a little warm glow every now and again when something that you've done has actually made a difference. So if you're not involved in consumer collaboration, please see Viv at the table today. Social conscience. So this is a piece that I thought was really important to note. So that consumer participation in health and medical research is often a policy, directive and a requirement of funding organisations, but should not only be practiced for those reasons, but rather as an essential component of good research practice. So basically saying, because of all those legislative frameworks, therefore you must participate. But then there's other people sort of saying, well, actually, if the only reason you're participating is because it's a requirement, is it good participation? So I think, that's where social conscience kicks in. And I think, it's got nothing to do with the United Nations or the World Health Organisation or those other significant legislative frameworks, because we know they are in play now. We know they're there. So we know we have a right to participate in the design and the delivery of healthcare systems, of research agendas, etc. So for those people who are thinking about it, whether you're a researcher, whether you're a funder, whether you're a consumer or whether you're a carer, just do it. Get involved. The Taurus study needs another 20. Ingrid talked about the AMSLS. It's got 3,000 people in it. There's 26,000 people with MS in Australia. So we've only got 3,000 of them. So you need to help us get the other 23,000 people into the AMSLS. And the other thing is, of course, if you look at the National Disability Insurance Scheme data at the moment, 26,000 people with MS, only just over 8,000 have gained access to the NDIS. So get involved in consumer collaboration, because you will affect not only the research, you'll affect funding, you'll affect policy parameters, and without your support, actually the people that are sitting in this room, the vast majority are consumers and carers, we will continue to get what we've got, but we actually deserve better. So get involved. Over to you, Viv.
Right, can everybody hear me? Thank you. I'm just going to take the opportunity to stand on the lectern and raise my stature, because like you, Des, I'm small in stature. I'm surprised you actually didn't take the opportunity. But anyway, that's just a joke. That's just a joke. So bringing this down to the micro level, Des talked about the global and policy level, but I want to talk about what actually we've been doing at the Menzies Research Institute with our consumer and community engagement. So what have we been involved in? And we had our initial focus group was involved with the development of the Understanding MS MOOC, which has been hugely successful. Many people in this room would have taken part in that course and been involved in its development. They provided the lived experience to many of the research projects that have been undertaken at Menzies, the Understanding MS MOOC being a clear example of that. We've reviewed patient information sheets and consent forms recently on the Taurus trial that Kalina talked about earlier. We've provided input to and reviewed grant applications prior to them being submitted, and I know that the consumer group is working with Professor Andrew Palmer and Julie Campbell on the carers cohort study that they're developing at the moment. We participated in online workshops for the initial development of MS short courses. So they're deep dive topics that have been identified via the Understanding MS MOOC that people have said, well, we would really like to know more about certain topics, and there's 4 of them that are being developed at Menzies at the moment, one being disease-modifying therapies, mental health in MS, and 2, ageing well with MS and carers cohort. And can I give a shout out here to Dr. Laura Laslett, and if you can never wave Laura, she'll be on trade table number 2. She's developing the ageing well with MS data, and also Dr. Julie Campbell. Is Julie in the room? Yep. Julie will be on trade number 2. So if you'd like to get involved with any of those projects, please see Laura or Julie at the lunch break. Other things that the consumer group have been involved in, we've participated in a Facebook Live conversation about the effect of COVID-19 and social isolation, and they participated with a group of people living with MS from around the country on that. The group have been involved in strategic planning sessions with Menzies, so making sure that the consumer voice is really heard and embedded into the future planning process for MS research at Menzies. We've assisted to develop and implement ideas that enables MS researchers community to actively engage and connect across all levels of the MS community and geographical locations. And I think this event is an example of that, because while Des pointed out that Tash and Jacob and I have been organising it, but a lot of the ideas for this event came through the Consumer and Community Reference Committee. So I would like to thank them for their input and their guidance in steering this event to fruition. The group also use their various MS networks. They're a small group at the moment, 9 in numbers. Their fingers and tentacles stretch into many MS networks, and I know that if we want to do something at Menzies, we just go to the consumer group and say, can you please enable your MS networks to assist us in this particular area? So thank you in that regard. Another thing that the group have been involved in is they've been sitting in on the biannual MS Students and Early Career Researchers Symposiums and providing consumer feedback and input into some of the PhD projects that are happening at Menzies. So this is my big call to action. This poster here, how to get involved and stay connected, they are in your delegate packs that you would have received as you entered the building today. Please, if you've got a mobile phone, you can scan that QR code and it'll take you straight to a survey to be completed online, and then we have your details, and when there's something that we think that the consumer voice is really, really important to be heard of, we already have your details there. So please do that if you can, and I will also be at the trade table over lunch if anybody would like to have a talk to me about that. There's various ways to get involved. Of course, we have a biannual newsletter for the Flagship through the Understanding MS MOOC that Susie will talk about later. We have MS workshops and events. We have MS focus groups, clinical trials and studies, and there's on trade table number 1, there's some information about those trials and studies, and also a big shout out to the one that Andrew Palmer mentioned, that he would like everybody to fill out that survey that's on your table. Also, and Ingrid has already mentioned about the Australian MS longitudinal study, and there's some beautiful new brochures that we just received yesterday that will be on trade table number 2 as well. Okay, so I'm going forward here, nothing's happening. So, if I just give a big shout out to say how the MS Consumer and Community Reference Committee was formed at Menzies. It was officially established in February 2019 with its own terms of reference. It reports through to the MS Research Flagship Steering Committee. The current membership is that we have no less than 6 and no more than 12 people, and we have at least 75% of the makeup should be female, which is to reflect the gender equation of people living with MS. We also have a requirement that the chair of that committee is a person living with MS. I'll give a shout out to the current members of that, and I believe every single one of them are here today. So, of course, Des, as chair of that committee, thank you, Des, for your leadership with that, but also Andrew Potter as the National Advocacy Coordinator for MS Australia. Thank you, Andrew. Mrs. Jane England, and Jane is here today with her mum, Julie. Thank you, Jane. Caitlin Wild. Who's down, Caitlin? I think yeah, Caitlin's on our consumer table at lunchtime today. Chris Gumley, that I think a lot of you will be familiar in the room. Meg Denham, thanks very much, Meg. Kerry Tomlin, who is a member of that committee. She also is a MS Employment Support Consultant. Peter and Hilary Hill, that are down the front here. So wonderful. They're the current members of our committee, and we have room for another 3. So if anybody would like to have a chat with myself or Des today, please feel free. So in closing, I just would like to really acknowledge the MS Flagship Consumer and Community Reference Committee, and also the Menzies Institute for Medical Research in a whole for the huge investment that they have put into the MS Research Flagship and also this committee. Thank you. And a shout out to our project funders. The initiative is supported by funding from the Australian Government. So thank you all.